I'm Anne Snowdon. I'm the Chief Scientific Research Officer for HIMSS. I'm a nurse by training. I'm also a full professor at a Canadian university, and I do a lot of research on where and how does digital maturity matter and to whom. So that's, in a nutshell, who I am and where I'm from.
Digital maturity is an important topic in the healthcare space, and there's been a lot of maturing in the past couple of years going on. Tell me a little bit more about what that entails and the type of research you do and what you're finding.
Yeah, it's a good question. Health systems talk a lot about all the many incredible technologies out there. This year at the HIMSS conference, of course, artificial intelligence is a big topic, right? In fact, artificial intelligence is 20 years old. I built my first machine learning algorithm in 2008, but, all to say, it's been around a while, but healthcare is a sector that's actually quite slow to adopt these technologies at scale, meaning can every person everywhere have the opportunity to be healthier or well or solve a health challenge with access to all the latest and greatest technologies? And the answer is not really. And in the case of AI, particularly not really. It's been in the research space for a very long time. But some of the research we're doing is to look at digital maturity in hospitals. That's one part of the health system. It's not the whole health system. And what are the outcomes they achieve if you're really advanced compared to those who are not at all?
Yeah. That's important, isn't it? Because when I think from the different stakeholders' perspectives, if I'm looking from a hospital perspective, then potentially the implementation of technology might come more from the office of the CFO if it's relating to cost containment or getting efficiencies within the clinic setting. And hey, if we get patient outcomes, then that's great too. Whereas on the, say, investment side, it could be that hey, we can speak about all of these cool emerging technologies and trends, and won't this be great how it'll shape the future? And hey, by the way, patients might have good outcomes. In the end, ultimately, that's the most important part. And so it's sometimes the challenge can be genuinely bringing those patient outcomes to front of mind when it comes to technology implementations. Is that kind of similar to the position that you take on it?
Absolutely. The technologies are fabulous. And sometimes I hear about them from many very, very talented people, companies developing them. And it almost feels like it's selling a dream. Because what really matters in healthcare is who are the patients your team is caring for? What do they really value? What's important to them? And in most cases, if you ask 100,000 people on the street what matters to them, it's being healthy. They don't tell you about their disease and diagnosis.
No, yeah.
Even though we all have them, right?
Yeah.
So for me, technology is simply about what purpose does it serve? What success can it achieve? And can you measure it so that you can demonstrate that? Because first and foremost, patients need to be confident in that before they're even going to contemplate using it.
How do you, on that point around measurement, because that's where my brain was going too, because it's one thing for us, we all get that, we're in this to improve the lives of patients and improve, hopefully, levels of population level of healthcare. But in the end, there's got to be a driving why and a justification and a return on investment. I think some of the challenges also revolve around this point of finding it difficult to quantify and measure, say, the outcome from a patient side that might be tied to something that drives action, like a financial kind of point too. How do you go about, how can some of these, whether it be vendors or hospital systems or different stakeholders within healthcare, go about framing these solutions and the need to implement more technology to drive those outcomes for patients that will actually get buy-in within these groups that need to have it?
It's a great question. And I maybe it's my nursing background, but I always start with what outcomes do people want to achieve, particularly the patient. If you tell a patient, this is a great technology, you'll have a 2.5 day shorter length of stay. That's a wonderful outcome. It's could be a financial outcome. It's certainly an outcome that serves the system. What does it do for me? as a patient. And for me, that's what's fundamental. However, it's not just about what a patient outcome they're trying to achieve. It's clinician outcomes. If a particular technology gets integrated into a system and it makes me add 17 more clicks to the 30 I already have to get to that technology to answer those questions or document my patient's progress, chances of me using that, not so much. So I think we really have to ask the question, how does it serve the purpose of enabling people to stay healthy and well? And I get, and health systems really have focused more heavily on disease management, disease outcomes. Can we cure this disease? Can we treat that one better? And that's great.
Yeah.
But generally, people want to have the tools and the connectivity with their providers to stay healthy and well.
Yes.
Particularly as people are aging. And all of our populations are aging, some faster than others.
Yeah.
So keeping people healthy and well is not as great a focus as, from what I can see, in so many of these technologies, but could be. So that would be one area. But the other really has to be any innovation, any digital transformation strategy has to meet the needs of all of the stakeholders. Start with the patient, because if it doesn't meet their needs, they're going to ignore it anyway. Then look at the workforce. Is it possible? Is it something the workforce will embrace because it makes their jobs easier, their work environments better? Great. Then keep going. How does it achieve operational outcomes, performance outcomes that every global health system has to report on to their payers, whoever pays them, right? And how does it meet the needs of your C-suite? Those CFOs, they have to be convinced with some pretty hard numbers, and the CEOs and board have to be able to justify it to their communities. So it's a multi-layered, and I think sometimes we forget that. We may focus on one, the patient getting better. Or we may say, this will help the workforce. Great. The fact is, it has to cover the whole system and be very focused on what each of those key stakeholder groups need to see. And that's when you get scalability.
Yeah. Do you find in satisfying the needs of all the stakeholders that it can be something that ticks all of the boxes? Because like sometimes it can feel like it's a sliding scale. Like if we're leaning more towards the patient side, we're pulling away from something else, and we're compromising in different areas. Is there outcomes? And it's quite a nebulous question, but are there examples or ways that we can demonstrate these benefits for all the stakeholders in reality?
It's a great question, and the answer often in healthcare, sadly, I'm sorry, is it depends.
It's like
but most importantly, if your transformation strategy, whatever it is, achieves very focused one or two outcomes, maybe for the patient and the workforce only, then you at very least have to position what the domino effect, if you will, the downstream effect will be on the system and account for it. And I think that's often what I see missing too. We will have wonderful technologies that people will tell me will save people's lives. Wonderful. How are you going to measure that?
Yeah.
And in order to do that, what are the other dependencies in this system that have to come together for that to be accessible? Yeah. So you can see it's a very system-focused strategy. The other thing we tend to do too much, perhaps, is focus on the acute hospital care, when the majority of the world actually get their health care everywhere else but, right? You might get into trouble and you need the hospital, and certainly we need them there, and they do incredible work. But if 90% of the health system costs are with people's chronic conditions, those are all in the community.
Yeah.
So I think this is a time with the many technologies advancing as quickly as they are to be looking at how are we mobilizing communities? How are we supporting our most vulnerable, our patients at greatest risk? Do we even know who they are? And so many of the digital tools, and even AI in particular, could be exceptional at doing that, but we tend to get excited about that hospital cool stuff.
We do, and it is cool, but then and I also think sometimes it might be related to the fact that when someone, when we need to provide the sick care of healthcare, where that's much easier, arguably, to measure in terms of
Yes.
the costs and the bed day saved and all of those things. If we're stopping people from getting sick in the first place, it's difficult to measure it if it didn't happen, if you know what I mean. So being able to quantify some of these tools that are out in the community and from a preventative side, and to do that, that's a tricky thing easy thing to say and a tricky thing to do.
Except if you created those tools so that the people... if you created those tools in a way that they were oriented to people helping themselves be healthy and well. So if I have my choice of digital tools, I might say, okay, it has to be on a smartphone, or no, I'd rather it be a website, whatever. And it allows me to establish with my provider teams my health goals. And I'll track my progress, and it helps me report what I'm doing that either gets me to where I want to go or doesn't. Now you've got patient-reported outcomes, so you know from the very person you are most focused on helping, knowing whether we're in the right direction or maybe we should switch gears because it's not working. We know many products, drugs, technologies work for some and not others. We see that in COVID.
Yes.
And we've seen it for decades. But we haven't created those digital tools that help people help themselves and track their progress so they learn what's working just as much as that nurse, physician, or team know what's working. So that's where I would say I think digital transformation could have a massive impact, but they tend not to focus on that as much.
No, you're right. And you importantly said that, there needs to be that focus, particularly on the vulnerable communities or those that we may not even fully have direct connection with, those that need the healthcare the most. Do you think that there's a risk that with more emerging technologies being introduced and the excitement and the hype that comes with that potentially we may be widening the gap further when it comes to injecting more technology in and leaving some people behind that need to be included the most?
I do worry about that. We are just finishing a study of 2,000 U.S. hospitals who've completed an assessment of their digital maturity. So the good news is these are 2,000 that want to know, how are we doing? 80% of them are at an MRAM level 0, which means they have an EHR, they have a pharmacy software, a lab, and an imaging, and a cardiac cath lab. None of them are connected. Our most marginalized population in the U.S. by zip code are far statistically more likely to be going to a hospital at level 0 than a hospital at level 6 or 7.
All right.
So in my mind, would pretty marginalize that person further if those clinicians looking after our most vulnerable have to run around and find what labs did they last have, when were they last here, how did that treatment work for them? What meds are they on? That's a disconnected system that doesn't have the interoperability they need. But it is also a system where that patient hasn't got a chance of figuring out what's been going on if they did have a digital access point.
Yes.
Right? So I do really worry that the digitally less advanced or not at all advanced hospitals and other organizations may be further marginalizing our most vulnerable, and that's something I think we have to address.
No, that is a concern. What do we do about that?
What do we do about that?
Is there hope? In terms
there's
of,
a lot of hope. The first step is recognizing where you could have the greatest impact. If I'm the chief nursing officer of a level 0 hospital, I am going to push that board and that CEO really hard to get out of level 0, connect those fundamental operational systems so that as I walk into that patient's room as a nurse, all that data is there and I have a much better conversation and more data-driven decision opportunity to help that person based on where they last were. Because right now, without that level of interoperability, like none, I have to rely on that person to remember who said what did that. I don't remember that. How do I expect them to? And I have to kind of knit it together and hope I get it right. That, for me, is creating a greater digital divide. So there's a lot of... That's an easy fix. But unless you know that's an easy fix that can get you to many more important person-centric, helping people help themselves, then it won't happen. So that's what I would suggest.
No, absolutely. And I'm glad you said that, coming from the front line as well, I'm a big believer that some of these big system changes that are needed within, say, a hospital setting, they don't necessarily need to be driven from the top to start with. If there's this groundswell of that alignment of, well, this is good for the patient, and there's the business outcomes that come with it too, then everyone will win. So there's certainly hope in that respect. Hey, look, we're coming near the end turn of HIMSS, let's say, and there's been a lot of conversations and a lot of great presentations, and a lot focused around the discussion that we've just had. What excites you about, leaving HIMSS 24 after this, and you've no doubt got a busy dance card in the rest of the year? Tell me what to expect and what you're looking forward to.
There is so much opportunity, and it drives me every day to figure out those really tough problems, like we talked about, the marginalized populations being one of a big one, right? Building those collaborations you need to build with those incredible companies that have come up with these amazing technologies, and helping them see where and how it can be embedded in a system to achieve great things. When we start working together and building those collaborations, not just with hospitals, our communities, our government ministries, we're both from countries where it's government funded.
Yes.
They need to be at the table to know what matters and how to get from where we are today to tomorrow. So the opportunity is unprecedented. It's mobilizing it and doing the hard work, but creating those teams across sectors, across organizations and systems, learn from each other to make it happen. That's what drives nurses, make someone's life better. And it's all right in front of us. It's just a matter, you've got all the cards, play the cards well.